Okay. Hi, Kim. How are you today?
I'm doing fine.
All right. And so we're going to go over some of the stuff that we already know about you. So, from the information that you have provided, you are 46 years old and you work at the library and you live with your daughter and your grandkids. And you've been coming to see us for an ongoing depression that you've had for the last 6 years. And you've tried multiple different antidepressants and they didn't work so well. So we were trying to find something else that worked a little better. And you had also said that you had problems sleeping, and you were taking melatonin for that, and sometimes it would work and sometimes it wouldn't. So last time you were here, we talked with your general care provider, and we all decided that it would be best if we tried Wellbutrin, which works a little different from the SSRIs. It affects your dopamine levels instead of your serotonin levels, and we were hoping that would work a little better. And we thought maybe adding some exercise into your weekly routine might help alleviate some of your symptoms with mood as well. So in the last 3 weeks, how do you think that's been going?
I guess it worked so, not as well as I expected.
Okay. All right. And have you been exercising too?
I did for the first 2 weeks, but I just kind of got busy and I just didn't really follow through with it.
Okay. All right. Okay. And so do you think that the Wellbutrin helped your mood at all, or?
I think it somewhat helped my mood.
Okay.
If had I exercised a little more, like you asked me to, I might have experienced a more positive effect of taking the medicine.
Okay.
But
well, that's okay. Did you experience any kind of side effects with the Wellbutrin at all? Like, is there anything that new or anything?
Not that I can think of.
Okay, that's fine. I just wanted to let you know about the kind of medication that you're taking, and that it's important to just not quit taking it altogether. It takes some time for this medicine to work. It usually takes about three weeks to a month for the effects of the medicine to really kick in. So Wellbutrin, or bupropion, is an antidepressant in the aminoketone class, which is used for the management of depression and some seasonal depressive disorders, like kind of in the wintertime. And some of the side effects that are common with Wellbutrin are agitation, dry mouth, insomnia, headache, nausea, vomiting, constipation, stomach pain, dizziness, ringing in the ears, vision problems or blurred vision, loss of interest in sex, sore throat, muscle pain, itching or skin rash, increased swelling, increased urination, tremors, changes in appetite. And then some more major ones would be weight loss or gain, really a lot of aching in your joints, strange taste in your mouth, diarrhea, and especially seizures. If you notice if you notice any of these side effects, we can do another video conference call with your general practitioner, and we could try another medication if this gets to be where it's not where it's doing more harm than good, I guess, And so we have you taking 75 milligrams of Wellbutrin twice a day for depression, which is about the lowest dose we could go. We could try to up your dose of Wellbutrin, or we could try to talk to your general care provider about possibly adding Abilify to the Wellbutrin. And so, as long as that's something that we're all watching together, because we have to be kind of cautious when taking it if you have high cholesterol. But since that's something that you've been working on with your general practitioner, and you've been using medication or what have you to control that, so hopefully, that will work itself out. So let's see. So if we start the Abilify, it does, if you have any allergic reactions, like hives, difficulty breathing, swelling of your face, lips, tongue, or throat, that's something that you need to go to the emergency room immediately for. You don't need to contact either one of us. If you are having some of these other side effects, like severe agitation or distress, or you feel like restless, twitching of your eyes or your face or anything like that, a mask-like appearance of the face, or trouble swallowing, or problems with speech, seizures, anything like that, need to go to the ER. If you start to have thoughts about suicide or hurting yourself, you need to call me or the doctor immediately. Any kind of severe nervous system reaction where you would get like maybe stiff or a high fever or sweating or confusion. If you feel like you're having uneven heartbeats or like fluttering in your chest. It's important that you go to your general care provider at your appointments, because he needs to do blood work to make sure your white blood cell counts aren't getting too low. We need to make sure you don't have any kind of fever, chills, that you're getting any kind of swollen gums, skin sores, anything like that. And it's important that we monitor your blood sugar, because Abilify can increase blood sugar. So, let's see. Some common side effects that aren't nearly as serious include weight gain, maybe blurred vision, nausea, vomiting, a change in appetite, drooling, a headache, dizziness or drowsiness, anxiety or feeling restlessness, some sleep problems, or cold symptoms. These usually kind of subside over time once you start taking it. So if we're having any of these side effects long term, we might look into changing the Abilify and the Wellbutrin to a different course of treatment.
Okay.
So an important thing to note is that once you start taking the Abilify, it's important to stop taking the melatonin, because those kind of herbal medicines like melatonin, they act kind of funny sometimes with antidepressants. So we don't want you to get to the point where you're too relaxed and then you start seriously having like difficulty breathing or difficult with heart issues or anything else. So is there anything that you'd like to add, or any questions that you have?
Yes, I just the part about the melatonin, like, and the Abilify, taking it together. Like, when you say, like, it causes other problems, like, what are some of the other problems it causes?
Well, the Abilify kind of amplifies the antidepressant, the effects of the antidepressant. So, because with melatonin, they kind of get tricky when it comes to mixing them with other kinds of.
But the melatonin is what helps me sleep, right?
Mm-hmm.
So does the Abilify make you sleep too?
No. One of the side effects for Abilify could be insomnia. So if you're having problems sleeping, then we could talk to your general practitioner about maybe getting some sort of sleeping medication to where,
I got you.
Where we could.
Okay. Alrighty. I don't have any other questions or concerns.
All right. So, you don't have any feelings, you still don't have any feelings of wanting to hurt yourself or hurt anyone else or anything like that?
No.
Okay.
I haven't.
All right. Well, if you start to feel that way, then just give us a call and we can get together immediately and we'll figure out the best path for that.
Okay.
So if it's okay with you, we'll go ahead and schedule another appointment to do a video conference with your general practitioner a week from now, and we'll go over some medicines that could help you get some sleep better than melatonin.
Okay.
That would mix with your Abilify a bit better.
Okay.
All right. Well, I appreciate you seeing me today, and I'll see you next week.
Well, thank you.
Thank you.
See you later.
See you.